I'm here with Dr. Jessica Knurick, rhymes with Currick, kind of. Knurick and Currick, it does rhyme.
It does rhyme.
The K is silent, and she's been doing an excellent job. If you're just joining us, really dispelling a lot of the disinformation that is out there about public health, and also explaining the impact of these policies on science, public health, and I think we overlap a little bit there, Jessica, because obviously I've been very interested in cancer advocacy and NIH funding and research university funding. And it's something that I have really committed a great deal of time and energy to for the last, 20, 27 years since my husband died of colorectal cancer in 1998. But, let's just get to a lot of topics. And I want you all to please feel free to ask any questions of Jessica, because I know the Substack community is one that's very engaged and smart. And I want to, yes, that's what we're starting with, measles. Even though you spelled it wrong, it's L-E, but I'm sure that was a typo. Anyway, so let's talk about this measles outbreak. It is a record high. It's hit a record high since the United States eliminated the disease. I guess how many years ago? When was it
2000.
eliminated?
I think 2000.
I think so too.
Yeah.
So let's talk about this and why it is so concerning, and why it in fact is happening.
Yeah, and I mean, I'll just start by saying I'm not a vaccine scientist, and so I kind of like know what's going on in the public health realm about this, but I really look to my colleagues who are much more focused on vaccines for this kind of
Understood.
information. But yeah, I mean, it was considered, to not be a concern back in 2000, which would have been 25 years ago. And I think a lot of times what we hear coming out of our public health agencies right now is that, oh, it's no big deal because way more people are impacted by chronic disease than infectious disease, and it's fine. But at the end of the day, the idea is that this is a preventable disease, right? We should have no cases of measles, and we should have no deaths from measles. And we've seen our worst cases and in decades, and we've seen how I don't even know what the count is, but a couple of childhood deaths from measles this year, and that hasn't happened in decades. And so I think that's where the real concern is that we don't have we are kind of regressing in terms of infectious disease, and the narrative coming out of this is that we can only focus on chronic disease and not really infectious disease. We're going to defund all of the research for infectious disease, and that's a false dichotomy. You can work on, and you should work on both.
Yeah, and I guess I know you're not a vaccine specialist, but I do feel like you're an information specialist in many ways when it comes to public health
Yeah.
and the messaging that we're receiving. Even though during his confirmation hearings, RFK Jr. insisted that he wasn't an anti-vaxxer, but there is a lot of skepticism that is being fueled by his positions and some of the things that he is doing. Someone says he's a wretched liar. Let's talk about
Well,
kind of the public health messaging that you've witnessed and the impact you think it's having on the general population.
yeah, I mean, RFK Jr.'s been the same way for decades now, right? That's why public health experts and scientists were sounding the alarm far before. I mean, even when he was running as a Democrat, a year and a half or 2 years ago, I mean, no, people were trying to say, like, this guy has been kind of maybe the most in terms of like the number one person in America to really see distrust in vaccine science. And so, now that same movement and that same person, he funded the Child Health Defense. Is that what it's called? The CHD?
Uh,
Yeah.
yeah, I think children's
Children's
health.
Health Defense.
Yeah.
Yeah, which is, I mean, a lot of anti-vaccine information came out of that and continues to come out of that. And, that was his entire MO. And so, the MAHA movement that he really like was the head of, really like the entire kind of ethos of it was to enable this kind of like rhetoric around vaccines to kind of bring him into the highest office so that he could actually enable change from a vaccine level. And when he did it, when he went through a Senate confirmation hearing, that was very evident. It was like laid out very like evidently, and people could see it. And, Senator Bill Cassidy, he mentioned how like concerned he was as a medical doctor, and he really should have been the one to vote against him
But he
because he
didn't.
knew that this would happen. And yeah, unfortunately, he didn't, even though he's a medical doctor and pro-vaccine.
I think some people don't appreciate or understand why we need to worry about measles. Do you feel comfortable weighing in on why measles can be very dangerous and this kind of outbreak is something that we need to take very seriously?
I That's actually the area that I'm not that comfortable in kind of talking about, just because I don't want to misspeak on areas that I don't have expertise in.
Okay, I understand. So what do you feel is your sweet spot when it comes to really appreciating what is true and what is false in the public health arena?
Pretty much all the other areas of public health
Okay.
outside of vaccine science. Yeah, so, a lot of the narrative coming out of, right now is this distrust in scientific institutions and the fact that we're like, we're poisoning our food supply. And I think with this MAHA movement, what they've been able to do is they've really been able to kind of tap into a real problem. I mean, and feelings in a bipartisan way of people really thinking like, oh, there is a problem with our food supply. There is a problem with public health in general, right? We do have rising rates of lifestyle related chronic disease. But what they've done is they've kind of manipulated the causes of those issues, and then when you do that, when you get the causes wrong, you really get the solutions quite wrong, and so that's what we're really seeing. We're seeing a lot of the causes are really rooted in the same conspiratorial language that the anti-vax movement is founded on, in terms of like toxins in our food supply that aren't allowed in other places, and our regulatory agencies are keeping us sick. And so that's really like what I try to help dispel is like, well, why is our food environment the way that it is? Is our public health infrastructure the way that it is? And trying to get people to kind of understand a little bit more of like where the actual issues are, so that we can come up with evidence-based solutions that are actually going to elicit change.
I think what's been so challenging about this MAHA movement is some of the foundational concerns are legitimate, right?
Yeah.
That obesity is a major epidemic. I did a documentary called Fed Up about how during the low fat craze, sugar was put into so many foods and resulting in obesity rates. Chronic illness has been a problem. Food deserts have been a problem. Additives, I guess, in some areas and ultra processed foods have been a problem. So I think some people gravitate towards this movement. But as you said, some of the information is being manipulated and misrepresented. And that's why I really appreciate the work that you're doing because you correct the record. And there's so much misinformation going on. Let's talk about kind of some of the biggest myths that you've seen come out of the MAHA movement, because I know it's kept you very busy correcting the record on several fronts.
Yeah, and I should just maybe mention the reason that I started doing that was really because my background is in chronic disease prevention. So the research that I did throughout throughout grad school and then as a professor was really rooted in how do we use diet and like nutrition and exercise and lifestyle to reduce risk of chronic disease. And as I was doing that, particularly diabetes, type 2 diabetes and cardiovascular disease, and as I was doing that, I really realized that we have a lot of really good evidence of like how to prevent or reduce risk of these diseases. But what we are lacking is the adoption of a lot of these behaviors. So if you look at the
Mhm.
behavior change research, it's very difficult to get people to change their behavior or to adopt some of these lifestyle recommendations. And so what I did was kind of look at these like easily adoptable strategies. And when you start to get into that research, you really can't get away from looking at systemic and structural reasons for a lot of these disparities. Because if you look, we do have a lifestyle related chronic disease issue in this country, but if you look, we're not all equally impacted by that in America. So, there's groups of people in this country that are far more impacted by things like type 2 diabetes and obesity and cardiovascular disease and stroke than other areas of the country. We see that, I mean, low income populations are twice as likely to have diabetes. They're 5 times as likely to report poor or low health status compared to their wealthier peers. And so when you're thinking through like how can we improve people's health, you have to look at those structural barriers to health. And so that's what I've been really focused on. So I think one of the things, to answer your question directly, that the MAHA movement is really doing is they're kind of distracting from all of that. They don't really talk about these disparities in healthcare. They don't really talk about these structural issues. They really are very focused on toxins in our food supply, distrust in scientists and regulatory agencies, and they take grains of truth and then they kind of exacerbate those grains of truth and weave conspiratorial narratives. And what you do when you do that is you get solutions that are not rooted in evidence and actually could make things worse. So an example is some of their solutions right now. I mean, let's just think through like what the MAHA movement has been successful with in the first 5 or 6 months here. They've successfully there's been statewide bans on fluoride, right? Because the idea is that fluoride, this really effective public health initiative that has helped improve dental health and helped close health disparities in our country. They're saying that it's toxic and it's bad for people, with no evidence to support that. And so they are banning in different states fluoride use in water. Well, there's no evidence to suggest that's going to improve anybody's health. And in fact, there's evidence to suggest it's actually going to worsen health disparities for people and worsen dental health. And I think RFK Jr. came out and said that more people are going to get cavities because of it. And so that's an example of like when you get the causes wrong and you're focused on the wrong thing, the solutions will often be wrong. So
There also
that's a big one.
I know that also food dyes have been something, and food additives, and comparing
Yeah.
US diets to European diets. And I know that you have debunked several of those things on social media as well.
Yeah, I mean, and I want to be clear because a lot of pushback that I get when I talk about food dyes is you just want everyone to eat food dyes. And that's actually not me at all. I would recommend that we eat less of the foods that generally contain food dyes because foods that contain food dyes are generally low nutrient, ultra processed foods, right?
Right.
That sure they can exist in an otherwise healthy diet, but like we don't want to make the majority of our diets those foods. And right now, the majority of American diets are these ultra processed foods. And so and that stems back from why our food system is kind of built for people to be following those diets. But in terms of food dyes, I mean, I think a big misconception, because there's so much on social media about it, is that we allow these food dyes here because we want to poison Americans, and no other countries allow them. They ban them because they're unsafe, and that's just not accurate. I mean, if you think about there's 5 main food dyes that are used in our food supply, which is red 40, yellow 5, yellow 6, blue 1, and blue 2. All 5 of those have been deemed safe here by our FDA, but all 5 of those have also been deemed safe in the EU by EFSA, their FDA equivalent. And actually, 3 out of the 5 have been approved for use at a higher level than what's approved for use here. All 5 of those have been approved for use in Australia and New Zealand, and all 5 have been approved by Health Canada and Canada. So they've all been by regulatory agencies said at these low levels that they're used in food, they're safe. We don't have evidence to suggest they're not safe. But that's not to say there's no differences. And I think this is where the nuance comes in. There are still differences between our food and food in some European countries, right? I mean, my husband's from Romania. He moved here in his 20s, so we go back a lot. And so I've spent a lot of time in like different European countries, and their entire food system is different than what we have here. It's not just that they use less dyes. They also have like corner markets. You can just go buy reasonably priced fruits and vegetables, right? Like farmers markets here are super expensive. Um, but they also use less of these artificial dyes, and that's largely just due to consumer preference, cultural differences, consumer preference. In the United States, we are very used to really brightly colored foods. Like I grew up in the 90s, and I remember lots of commercials with like the mascots of all of these like cereals and,
Right.
all of these like,
My mom would never let us get sugar sweetened cereals. I'd have to go to my friend Janie McMullen's house to eat Cocoa Puffs. And but she would never buy them. That so I
Yeah.
now looking back, I'm very grateful. But you're right. Like I saw a girl on the plane when I recently came home. With a big bag of Skittles on her tray table. And I wanted to say, don't eat those Skittles, young lady, but I didn't want to do that. But you're right. So
Yeah,
how
don't do
else?
that.
Yeah, how yeah. How else is food in other countries, Europe specifically, different? I just got back from France. I know that their food is really delicious, but what do you think is are some of the main differences in terms of their food supply versus that in the US?
Yeah, so I did a video, it's actually pinned on my Instagram page about kind of the history of our food supply and how we got here. Because right now, best estimates are that our food supply is about 70% ultra processed food. And so, that if our government guidelines, by the way, our science based government guidelines are to make half your plate fruits and vegetables and limit low nutrient ultra processed foods. And so, what we're recommending to people is exactly the opposite of the food environment that we've built in this country. And so
Mhm.
why is that? The reason is because our food environment was really built for corporate profits, right? I mean, at the expense of people's health, because of the economic system that we kind of have built and prioritized, corporations and food corporations, they have been able to, first of all, because we have pretty like easy, we allowed a lot of these corporations to kind of merge and acquire other companies, so we have very few corporations that kind of own most of the food supply. And within that, these corporations, their goal is profits and growth. And so if your goal is profits and growth, what are you going to do? You're going to use the cheapest ingredients. You're going to cut costs where you can. You're going to try to make your food as enticing as possible, right? Because we have plenty of food available in this country. So how do you get people to eat more of your food? Well, you do things like use artificial food dyes, because we have a lot of research about kind of the psychological experience of food, and people love those brightly colored foods.
Not only brightly colored foods, but don't they actually have sort of a method that in terms of making these foods, like it's about your palate and sort of that fat salt combo that really makes creates almost an addictive situation for people. I remember reading about that with like the palate, what it does to your palate, and kind of the combination of either sugar and fat or fat and salt.
Salt, sugar, fat.
Yeah, and that they're actually trying to get people a little addicted to some of these ultra processed foods. What do you know about that, Jessica?
Yeah, I actually had a conversation a couple months ago with Michael Moss, who wrote Salt, Sugar, Fat, and kind of he's an investigative journalist who looked at a lot of that. And yeah, I mean that is really well known that these corporations, they look for these like bliss points, right? And you can use salt, sugar, and fat to might make foods hyper palatable. And so that's their goal is to get you to eat more of their food. And that unfortunately, we have kind of enabled that, because that is what drives profit for those corporations. And that's not what's best for our health. Obviously, is to overconsume that. And so what's happened is we now have a situation where over 90% of Americans aren't meeting vegetable or fiber guidelines. Over 50% of Americans are eating too much added sugar, and over 70% of Americans are eating too many calories for their needs. So we're not really enabling a food environment that kind of helps people to eat the way that we would recommend people are eating. And so versus in Europe, and by the way, Europe's not a monolith. So there's different countries. For example, in Romania, where my husband came from, the intake of these low nutrient ultra processed foods is the lowest in any European country, last I checked. So they are very much still about like eating, you know, at home and eating a lot of fruits and vegetables. Well, actually, they don't even eat that many vegetables. They eat a lot of like cabbage and things like that. But eating foods that you can just go pick up at your local like farm stand. Um,
Right.
But, in countries like the UK, they are seeing kind of increases in these lifestyle-related chronic diseases, and they're seeing increases in the intake of these low-nutrient, ultra-processed foods. But in general, they have much better local food systems. They don't from our agricultural policies, we really incentivize and we really, through subsidies, we subsidize commodity crops in our country. So corn,
Like
wheat, and
corn.
soy. Yeah,
Yeah. For
corn, wheat,
like
and
high
soy.
fructose corn syrup, right? I mean,
I
that's a big
Yeah, I mean,
factor.
corn actually 40% of corn goes to fuel in our country. 40% of corn goes to animal agriculture for animal feed. And so that leaves about, 20% for us for food. And a lot of that goes into things like high fructose corn syrup. Yeah, because corn, and the reason we use more high fructose corn syrup in these ultra processed foods, again, is because it's cheaper for us than cane sugar because we subsidize corn here. So it makes it cheaper. And that's really the goal of these corporations is to make their foods cheaper. Versus, if we weren't subsidizing those things and we were using a little bit more of those subsidies maybe towards fruits and vegetables to bring down the cost of fruits and vegetables, if we were helping incentivize farmers with more, with grants and things like that to kind of transition some of their farms into more like sustainable agriculture and growing more fruits and vegetables and more local foods, because one of the things that happened in the 70s and 80s is we kind of decimated local food systems. And so now we have really large agribusiness, we have really large farms. And what happened with that grow basically monocrops. So they'll grow corn or grow soy. And what that means is that we became much more heavily reliant on these prepackaged foods that could travel
Right.
far and were shelf stable versus, these local food systems. And you brought up food deserts in the beginning, and that's a problem as well. So in rural areas, we have these food deserts. Most of when we talk about food deserts, it's more in urban areas and just kind of like food. Like grocery stores and things that have left those areas. And that's just not as prevalent in Europe.
Let's talk about sort of the latest policies, whether we're talking about the bill that just passed, which I refuse to call it beautiful because it's going to result in so much suffering and so many people are going to be less healthy as a result of these quote unquote priorities. But you've written a lot about the impact this bill is going to have on public health. Can you talk about that? I mean, not just Medicaid and SNAP, but also other areas?
Yeah, yeah. So, the bill essentially, what the big ugly bill, that came out is really, it's a public health disaster. I think those are the terms that I used in one of the things that I wrote, because we when we started talking, I was kind of talking about health disparities in the country, right? And the whole goal with the MAHA movement with the Trump administration, on his inaugural address, he said he was going to end the chronic disease crisis. That those were his words. And so, if you want to end the chronic disease crisis, as someone who's been, studying this for the last 15 years, you have to look at who's most impacted by chronic disease. And that's low income people in this country by far. And so, what are the strategies, the public health strategies we have to really impact those low income people and really help them? The two biggest ones are Medicaid and SNAP. And Medicaid really provides healthcare because two of the biggest determinants of health are access to healthcare and access to food. And so, Medicaid helps to get everybody access to healthcare so that, what happens when you don't have access to healthcare is you will just kind of like wait till longer, right? You're not going to go to your checkups. You're going to wait till there's an emergency and you're going to show up at the emergency room, and they're still going to treat you, by the way. You're still going to get that health care. And those costs are going to be kind of passed on to taxpayers through different ways. Increased hospital costs, also uncompensated care that we all pay into as taxpayers. And so that's a big one, just stripping healthcare from people. Billions of dollars are being taken from SNAP, which is the Supplemental Nutrition Assistance Program. It's the largest cut to SNAP, in addition to the largest cut to Medicaid in history. And so, SNAP is really, it helps to decrease food insecurity in this country. It directly helps to decrease food insecurity. So when you take, hundreds of billions of dollars away, it's going to increase food insecurity, which is one of the biggest determinants of poor health in our country. And so that's a big concern as well. And then
Also,
just,
nursing homes, right, Jessica? I mean, nursing homes are really going to bear the brunt of some of these cuts, are they not?
yeah, so Medicaid, Medicaid is a huge provider in terms of like funds for nursing homes and rural hospitals in our country. So what the estimates are was because of these Medicaid cuts is that 1 in 5 nursing homes will likely close, and for rural hospitals, hundreds of rural hospitals will also have to likely close, and that's because they won't be able to. They already have very low margins, both of these things, and so they're not going to be able to keep operating without those funds from Medicaid, which is what the and just to be clear, because I think there's some confusion on like why people would be losing their Medicaid, because one of the ways that they're doing this is they're instating work requirements,
Right.
right? And so they're just
Yeah,
saying,
I would love you to explain that because it's very confusing.
yeah, so I mean, and that's the talking points to the supporters of this is like, oh well, just able-bodied people should be working. And just to be clear, there's very few people on Medicaid who are not working and are able-bodied, who don't have some sort of exemption, like they're caring for a child or they're disabled or they're going to school. It's I just did a video about this yesterday, and latest estimates are it's just shy of 2 million people, which is a very small percentage of the overall Medicaid of people on Medicaid. And so that's not going to cover what they're projecting to be saving in Medicaid dollars. So the way that work requirements work, and we know this because some states have implemented work requirements in the past, and so we have data on this. Work requirements do not increase the number of people working. They never have when they've been done in the past. But what they do is they implement more paperwork and more barriers. And if you've ever tried to navigate the Medicaid system, it's very difficult. Both of my in-laws were on Medicaid, and my husband would spend literally like half his entire workday trying to get them set up on Medicaid. Each year he would have to go through this. And now it's going to be even more that they're going to have to do. And so what happens is a lot of people just don't navigate that system. They either can't or they forget, like they don't realize that it like is coming up. And so it lapses and they lose their health care. So a lot of eligible people will lose their health care who can't navigate the system and those paper requirements. So they call them work requirements. They're more like paperwork requirements at the end of the day, and that's how people lose their health care.
So there are other programs that, what I think is so ironic is if the administration wants to tackle chronic disease, they're getting rid of so many things that will actually reduce chronic disease. For example, like diabetes prevention programs, obviously cancer research. Can you talk about some of the programs that you think were starting us on the road to manage and prevent some of these diseases from happening and how they've reversed course on those things?
Yeah, so there's just been a lot. I have a whole Substack article of everything the Trump administration has done to kind of like dismantle public health in the first 6 months. And this is really the issue is that people are really focused, and why I like bring up like food dyes and things. People are really focused on like getting, these promises from corporations to remove food dyes, while all of these things are happening that are really going to just be so detrimental to public health. So not only obviously in this big beautiful bill, those cuts, but we've also seen the Trump administration has cut over $1 billion from programs that helped local farmers provide fresh produce to schools and food banks.
Wasn't
Um,
that even before the bill, though? Wasn't that, or is
yeah,
that
that's not
part
in
of
the
the
bill.
bill? Yeah,
Yeah, that's not
because
in the bill.
I know, and that not only helps the kids immeasurably, but it's also really helpful to the farmers who are part of that program, right? That they can take their excess produce
Of
and then
course.
donate it or sell it to school systems, so these kids can have healthy food, right?
Yeah, yeah, of course. I mean, and there were reports of farmers who they had already bought all of the necessary seeds and they had planted for this, and then they were losing their funding and they didn't really know what they were going to do. Um, Yeah, that's a huge one because I mean, if you're thinking about like how are we improving health, we're trying to get like fruits and vegetables to schools and food banks, and so there've been many other cuts to food banks, and so a lot of food banks have had they've lost a lot of funding, and there's been lots of stories all over the country of that happening, and so that's a real problem. Another thing is food safety rollbacks at the USDA and the FDA. They're just rolling back food safety programs and food safety protections. Their goal goal, and a lot of this was outlined in Project 2025. So it's not, for those of us who were paying attention, it's not actually, a lot of it's not that surprising because we knew it was coming. But their goal is really to shift the burden of like food safety to the states and not have as much at the federal level. So they're rolling back a lot of these food safety regulations, like milk inspection, when we had like the bird flu outbreak in anyway. And
Wait,
so
can I just ask you, can I interrupt for 2 seconds?
yeah.
Oftentimes, the MO is sending it back to the states. And I think on the face of it, people may think, well, that's okay. The states are going to take care of it. Why is it such a bad thing to send it to the states?
Yeah, I mean, there's many reasons in terms of food from a food safety perspective. I mean, we have a national food supply, right? And so there needs to be a lot of communication across the board. And so when you go and you have 50 individual states doing their own thing, that first of all, that ruins communication. When you have a breakdown of communication, it makes it a lot easier for people to not realize outbreaks are happening or to prevent things with things like recalls, right? We've gotten a lot better with recalls. I mean, a lot of people might notice that we have more recalls happening. That's not necessarily because we have like a more less safe food supply. That's actually because we're getting better at kind of warning you that there can be potentially something that's going on. And so that communication can break down if you push it to the states. But not only that, it increases disparities because some states will have the funds to have robust food safety programs, and other states will not, and they won't prioritize that. And so you really, I mean, it's that it really will increase kind of the disparity in terms of like who has safe food and who doesn't have as safe of food.
Yeah,
Um,
when
so
I think about handing it back to the states, I'm like, "Oh, great." Well, a lot of times they're not gonna have the budgets. They're gonna have, they're strapped for cash, and they may not make it a priority. But you also
exactly.
point out that we need these federal guidelines, and we do have a national food system, so it's really critically important for people on the national level to be involved in this. We got a lot of questions. I mean, we could talk all day about so many of these issues. I just highly recommend, if you don't already, that you all follow Jessica on social media and subscribe to her Substack because her information is invaluable. But, as always with these conversations about how screwed up the state of the world is right now and our country, a lot of people want to know what are the solutions, and so I guess the question is, I mean, what can be done about all these cuts, all these changing priorities? I think about the cuts to cancer research, and they're stopping clinical trials, and they're not funding people. We're seeing a significant brain drain with scientists going to other countries where they can get their research funded. But I guess, first of all, what impact is this going to have on overall public health? I think you've kind of illuminated that pretty well. But is there any coming back from this? And is there anything that can be done as we see this sort of systemic dismantling of many of these programs?
Yeah, so I think a few things. The in the bill, a lot of the like most harmful aspects of it when it comes to public health at least are not happening right away. So they kind of strategically put it in there so that a lot of the cuts don't happen until after the midterm elections. And so it's not great because people won't feel that, and so maybe they won't realize it's happening. But it could be potentially good because if there's a change, we could see some of that kind of shifted. We could see policies change. We could see maybe not as big of an effect of what's being predicted right now.
But having
Um,
said that, though, Jessica, some cancer programs have already been stopped. I know of a woman who was
oh
on
yeah.
a clinical trial for colon cancer, and they had to delay her treatment because their staffing wasn't there. And so they couldn't, so they had to put it off. And when you have a disease like cancer and any other debilitating disease, time is of the essence. So it's some of these cuts are taking place now, are they not?
Yeah, I was just trying to be positive.
Okay, sorry. 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 Yeah, but I'm
Yeah,
just
but,
saying in
let's
some
let's
cases,
talk about
right?
the scientific research side a little bit. So, there have been immense cuts to scientific research so far. We've seen billions of dollars in losses of these grants, and you know, a lot of that has been fought in court, and then they'll say, "Oh, it's you're not allowed to actually make these cuts." But as you allude to, if you lose funding on these kind of like studies that these longitudinal studies that you need to be continuously collecting data, and you have a gap in data collection that completely wipes out your kind of your study. And so we're seeing that. We're seeing I talk to young scientists, PhD students, early stage career scientists all the time who are just not only are they losing funding or losing PhD spots right now, but there's just this incredibly low morale that we've really never seen in science before. And what that's doing is it's really forcing people to think, "Oh, do I even want to be in this field? Do I even want to, continue in the sciences, or do I want to go to other countries?" Because by the way, some other countries are creating these programs to like adopt US
Like
scientists.
I think I read about France kind of having a whole new
Yeah.
program and saying, American scientists, we welcome you here. We'll
Yeah.
support your work.
Yeah, and so yeah, that I mean, I think that a lot of people aren't realizing that this is happening in the sciences, and that's kind of what I try to bring light to because there's so much that's going on. So I know that it can be hard, but I mean, the erosion of scientific expertise is incredibly scary for our country, right? And so we really have to like make sure that we're paying attention to that. In Trump's fiscal year budget 2026, they're trying to cut 40% from the NIH. And by the way, 37% of that is coming from the National Cancer Institute. But you don't do that. The NIH is like the premier research institution in the entire world. It's where a lot of our basic research happens, right? From the NIH. So, there's a couple of places you can get funding for scientific research. You can get it from either government grants through the NIH, which is a little bit over 50% of all research grants. You can get it from industry, so different industries, pharma or medical device, and different corporations. And generally, industry is going to fund research that is going to bring them profits in the long run, right? They're going to fund new drug trials. They're going to fund, new device trials, those types of things. And then a little bit, like less than 10%, comes from things like the American Cancer Society, like these nonprofits. So the vast majority comes from the federal government, and that's really important because that's what funds like basic research that,
Yeah, I think,
corporations aren't going to fund.
I was going to say I interviewed Francis Collins, and he explained to me that NIH is really a clearinghouse for funding all these programs at research universities all over the country. So when you cut NIH, you cut funding for all these universities and research centers.
Yeah, I mean, many academics that their entire salary is funded through research grants, right? So they're applying for research grants and they're continuously applying for these research grants. And so, I mean, 40% funding is an immense amount of money just cut from our premier research institutions. And again, that was kind of outlined in Project 2025. Like that was a thing that we kind of knew was coming if this administration took power. And so, that's coming in that's in his fiscal year 2026 budget. So you ask like what people can do, we can start kind of talking about this a lot and saying like how detrimental it can be and getting people to push back and call their senators and their representatives and do as much as we can.
Yeah, do you think someone asked, is anyone in Congress addressing the public health concerns that RFK is creating? I think people are talking about it, but unfortunately, they are not in the majority, so there's not that much they can do.
Yeah, so I've been to Congress a couple of times, just to kind of raise the alarm on different things and talk to some of the senators and representatives. And then I'm in touch with a few of them just pretty routinely as well. And so I do know that a lot of them are very aware, particularly about the science funding cuts and things like that. And I consistently ask, what can be done? What are you guys doing? And I mean, unfortunately, what I am told often is either they're relying on the courts, or there's not elections have consequences, many of them have said to me, unfortunately, and, that means that they're in the minority and they're not able to do a lot right now.
But are some
So
Republicans, are you talking to any Republicans? Because obviously their constituents care about this, right? They
yeah.
rely on Medicaid, they rely on SNAP, they need public health, that public health infrastructure. So I'm just curious if you've talked to some Republicans and they're starting to raise concerns about this and not necessarily falling in line with the Trump administration.
Yeah, I have, and, I have tried to talk to more who wouldn't talk to me, but, I think that there's a lot that I know of that are very concerned kind of, like, internally, but then when it comes to at the end of the day to voting, they're voting against what they're concerned about, and, I don't pretend to be a politician to understand why that's happening, but, I think it's fairly clear.
Yes, I think so too. Someone asked if you'd ever run for public office. You know, there's a pediatrician who's challenging Lindsey Graham in South Carolina, who I'm going to be interviewing at some point. I'm just trying to schedule it. Do you think that that is something that appeals to you, where you could actually have an even greater impact on public policy, perhaps?
I'm not sure. I don't think so. At least not right now. I have a 5 and a 2-year-old, and it doesn't seem like something that I could do at this stage. But, yeah, I don't know. In the future, maybe. But I don't know that I could have a greater impact just as a single representative in Congress, as I could kind of, like, being a voice for what's going on. I'm not sure that I don't know that I believe that, but maybe it's possible. I don't know.
Yeah, well, you're not ruling it out anyway. Um, what else was I going to ask you? So my team just texted me. I wanted to make sure you're okay time wise, because we'll wrap things up in a moment. But I'd love to hear from our audience and people watching if they have any questions for you, because that's one of the great things about Substack is we can
Yeah.
talk to people directly and answer their questions. Stephanie says you would get my vote. So I think you've got a lot of supporters out here, Jessica, who again really appreciate what you're doing. I think we're just getting a
Yeah,
lot
and
of
I I
people
s I
joining us.
saw I saw a lot of people say vote in the midterms, and, like, when we're looking for things that we can be doing, that is something, right? Like, vote in the midterms, and then also, support, evidence-based voices, right? So right now, we're really in this, like, kind of era of, a lot of misinformation as we were kind of talking about, and I think, there are people out there who are providing really accurate and they provide sources, they're providing good information, and just supporting them and sharing their work and, like, uplifting their voices, I think is really important right now.
I agree with you wholeheartedly. I just, as somebody who, as I said, I've worked very closely with cancer scientists and researchers, and this whole anti-science movement is really disconcerting to me because these are people who are really selfless and work tirelessly and are trying to make a huge contribution to humankind. And for whatever reason, this lack of respect for science, I think, became even more intense as a result of the pandemic. And there's still a lot of misinformation about COVID and about vaccines. And I think part of the problem is we're all siloed into our own media ecosystem, and so what we believe is only reinforced. And unfortunately, if people are getting inaccurate information, they're part of this whole system, this, echo chamber where their views get validated over and over again. And it's very hard to get out of those. And that's why I really appreciate you, uh, taking this misinformation and correcting it with scientific evidence. So thank you for that.
Yeah, yeah, of course. And I'll say something about that just really quickly. I do think that we have to take a little bit of blame ourselves as scientists and public health experts. I think for a really long time, scientists in general, we write in a way that's not really accessible for people. We publish our work behind paywalls that isn't really accessible for people. And for a very long time, it was really frowned upon to meet people where they were going for information, which for better or worse is social media. And so we kind of missed the boat for a long time on explaining things and having more science communicators out there, it kind of explaining the science in a way. And so we allowed kind of that narrative to be dominated by a lot of kind of voices that were maybe trying to sell their products or grow their businesses, and play the social media algorithms that really rely on misinformation and conspiratorial information and fear-based information. And so because of that, once you get into that algorithm, I've heard from a lot of people who kind of will see my content and they're like, thank you so much. I just never had the opportunity to hear another side of this. Like, I have only ever heard this side, right? Like food dyes are
Mhm.
banned in Europe, whatever it is, right? And so I think now we're realizing that and more of us are trying to kind of come to places like social media and spread evidence-based information and scientific information.
Which is wonderful, and by the way, scientists couldn't talk in plain English even way before social media even existed, and it's interesting you're saying from an insider's perspective that was kind of looked down on. I know Alan Alda was working very hard to help kind of scientific and medical people communicate more simply, and, you really have to be able to synthesize and dissect all these complicated medical terms. I learned to do it when my husband had cancer, and I had to kind of understand, what was going on and all the different therapeutic approaches. So I kind of, and people would explain like anti-angiogenesis is like a tumor is like a grape and it's on a vine. And if the grape stops getting nutrients, it shrivels up and dies. And that's what a tumor does when you stop the blood supply. You know what I mean? Like stuff like
Yeah.
that. And that's why speaking in plain English is so critically important. Well, listen, thank you so so much for doing this, Jessica. As I said, I started watching your videos. Gosh, I guess maybe I don't know 6 months to a year ago, and I've been trying to tell everyone to follow you as much
Thank
as
you.
I can. So you're doing such a public service. So thank you so much.
I appreciate that so much. Thank you for having me on.
I told, Jessica, you guys, before we started that I called her, I told my team she's the Heather Cox Richardson of public health, and she said that was a big compliment. So
Yeah.
we need more people like you out there. So thanks again.
Thanks, Katie.
Okay, bye, Jessica. Bye, everybody. Have a good day.